TMS is much kinder and gentler than ECT. ECT involves actually running an electric current through the brain itself. It causes a seizure, and there's something about the seizure which treats depression. We don't really fully understand why that happens, but we know it does happen. ECT occurs in a hospital, usually in the recovery room right outside the operating rooms. There has to be an anesthesiologist there. They start an IV. They run in medications to knock you out and muscle relaxers. Again, there's a seizure that gets caused. People are confused often for a couple of hours afterwards, and you're not allowed to drive yourself home because of that. TMS, on the other hand, is an office procedure. We do it right here in our office in Randolph. It does not involve any of the things I just mentioned. There is no anesthesia. There is no IV. People don't stop breathing, actually, which also happens during the seizure. And there's no electricity passing through the brain. We just have this magnetic field, which is really not much different from the magnet that you might experience if you have an MRI of your brain, for example. ECT is the most effective treatment for depression that we know of. However, it's a big deal, and we usually save it for last resort. As a last resort, it's a good last resort because it works better than the things that come earlier than that, but it has the potential to cause pretty significant headaches and muscle aches and probably some memory loss in some people. TMS, not only does it not cause memory loss, but there's some evidence that it may actually have what we call pro-cognitive effects. In other words, it may actually help people concentrate better. In any case, it's pretty clear that it does not cause any kind of memory damage. TMS is a procedure that does not affect your level of consciousness. It doesn't affect your ability to think or speak. So in other words, after the treatment is over, you feel just the same as you did when you walked in. You go right into your car, you drive home or back to your office and carry on your usual activities.